Section E, Reconstituting Medications. So these are your objectives and these are your optional reading assignment, and make sure you do your Section E ATI Med Math work assigned on Canvas. Section E, Reconstitution and Medication Calculations Practice. So this over here are the steps that you have to follow in order to make sure that you have the right amount of drug that you're going to be administering. So first we're going to read the order, followed by identify the supply and directions for dilution, verifying the expiration date, and then we dilute the fluid, we identify the solution and new supply, we calculate the amount to be given and prepare for amount, and then write on the label the solution may include the date, time, your initials, and then if not administering right away, we need to make sure that we store it according to the direction. Alright, so let's take a look at the specific medication and try to follow the order. So first we need to read the order, right? So we look at the order, and our order is Tazicef 500 milligrams IM times 1 now. Next, we have to identify the supply and directions for dilution, and we need to verify the expiration date. Here, you will be able to find your expiration date and then your lot number. So depending on the medication, you may find it somewhere else. It's not necessarily on the same spot every time, but usually it's labeled as EXP, which is the expiration, and LOT for the lot number. And when it comes to the directions for dilution, we have to magnify a little bit, right? And usually they're written in such small letters, so we have to be very careful when we're reading the direction. The direction says here, so usual adult dosage 1 gram every 8 to 12 hours in severe refractory or life-threatening infections, and then 2 grams every 8 hours. See accompanying prescribing information. So in 2 stages, add sodium chloride injection. So that's the kind of diluent that we're gonna mix. So one of them, right? And then it says here sterile water for injection or bacteriostatic water. So we can choose either or of the 3 options that we have. And it says here that according to the table below. So see accompanying prescribing information, shake well. So over here we have a table telling us on the amount of diluent that we have to mix. So on this side right here, we have the concentration, and then this is the amount. So since we are given options for the specific drug, we have to think, how am I administering this medication? So it says on the order that it is an IM injection. So if it is an IM injection, do I really want to inject a lot in the muscle, right? Is there really enough space to inject so much fluid? So generally, if you're really going to critically think, then you're going to think of, well, we can't be giving too much fluids within the muscle. We are given the option to add 26 ml or 56 ml. So if we add 26 ml, the final concentration will be 1 gram per 5 ml. While if we add 56 ml, we're going to have 1 gram and 10 ml. So that's something that we have to think about when we're giving this medication, especially when we have to reconstitute it. So then let's try to fill this information. So type and amount of diluent to be added. As we've read from the direction, it says that we can use sodium chloride. We can also use sterile water, and bacteriostatic water. And it also wants to know the amount. So as we were talking about earlier, we have to consider what's the injection site. Obviously, if we're going to give IV or intravenously, then we have more room for the fluids, right? But when it comes to administering intramuscularly, we have to think, where are we going to administer? Which ones are the most common areas or sites to administer IM? So typically it's in the deltoid, right, in your upper arm, or sometimes the gluteus area. So even though it's a bigger area, still you have to think of how much can we really give in that muscle. So in this case, since it's IM, let's choose the one with less diluent. Let's add 26 ml. So 26 ml of diluent. Now, it's asking here the dose strength of the mixed medication. So when we talk about strength, this is actually asking you for the concentration. Concentration. So in this case, since we chose 26 ml, our concentration is 1 gram and 5 ml. So 1 gram per 5 ml. So let's identify 1 gram per 5 ml. So even though it's written this way, we have to take in consideration which one is our have, which one is our supply. So here we need to identify that this is our supply, right? And this is our have, because we have to use the same formula that we've always used, because the next question is, what will the nurse administer? So how much will we administer? So same formula, desired times supply over have, right? And so our desired is the order, right? So we need 500 milligrams multiplied by, on top is our supply. So it says here that there's 5 ml. And at the bottom, our have. So what do we have? 1 gram. Oh, wait a minute, right? Can we do this? Can we directly multiply this? Not necessarily, right? Because we can't cancel it out. So we need to figure out how to convert the 1 gram into milligram. So let's raise this, right? And so how do we convert milligram to gram? So 1 gram, we have 1,000 milligrams. And then here in our supply and have, I have 1 gram, and then I'm going to use the supply, 5 ml. So now we can actually cancel it out. This cancels this, this cancels this, this cancels this, and then we just have to multiply. So 500 times 1 times 5, that number is 2,500 over 1,000. 2,500 over 1,000, so 2,500 divided by 1,000 is 2.5 what? 2.5 ml. So that is the amount of medication that we're going to give. So the answer is 2.5 ml. Right? So we did this part right here. We read the order, we identified the directions, and if we're in the hospital setting, we actually dilute the fluid, right? We mix it together. We identify the new solution and new supply, which we did in order to determine the amount of drug to give, right? Then we calculated it. Then we need to write on the label the solution made, right? So once we mix everything together, and let's say we draw it in a different container or syringe, we have to put our label. So we need to add the date, time, and an initial, and as well as the identifier. What medication is it? And then lastly, we have to make sure we're storing it according to the direction, especially if we're not going to give it right away. So we did all the steps. So now it's your turn to practice. I will give you the answer key to this practice problems. So you're not going to be graded on this, but this is very important. So the more you practice, the more you're going to be more comfortable in calculating for all these drugs and really reading the label. So it takes practice, right? So I want you guys to go over all these problems and try to answer them on your own. And then afterwards, I will post the answer key and as well as a video explanation of the answers. So go through all of this. Make sure you're practicing, because labels are going to look different and you will have to be able to identify and look for the information that you need in order to know how much medication you are going to give. So you have all of this, and then you also have additional problems, right? You have the insulin sliding scale over here and other problems, because from now on, right, you're going to be tested on materials that were previously discussed, and supposedly that's previous knowledge, right? So it's fair game to see on your upcoming test questions that you would see under section A, B, C, D, and E. So these are just practice questions. So that's it.